For the past several weeks, we've talked a lot about the work that frontline healthcare providers are doing to keep people in Maine safe. We've talked a lot about their quiet, powerful heroism, going to work every single day at a time when many of us are staying home, and how by doing so, by choosing to go to work, by choosing to take that risk and displaying that courage, they have helped to keep Maine people safe. Those individuals have taken care of people in Maine, and I'd like to spend a moment to talk about ways in which we are taking care of them. Displaying that courage, displaying that quiet, powerful heroism entails recognizing and getting up every morning knowing that your workplace is a place of risk. And doing that every day, we know, can take an emotional toll on individuals who are doing so. And that's why today, the Mills administration is announcing a frontline warm line. This frontline warm line is designed to help Maine's healthcare workers and first responders manage the potential emotional toll of COVID-19. This phone support service is staffed by volunteers, and the Frontline Warm Line, which officially launches today, will help Maine healthcare workers, first responders, and others who are contending with COVID-19 as they provide healthcare and other services. It will help those individuals manage the stress of serving on the front lines of the fight against the COVID-19 pandemic. This frontline warm line is intended to serve healthcare professionals, as well as emergency medical service personnel, law enforcement, and anyone else who is directly responding to the pandemic across the state. The line is being graciously staffed by volunteer professionals who have been activated through the Maine Responds Network. The Maine Responds Network is a network of volunteers, individuals, each and every one of you, who have decided to volunteer and enlist with Maine Responds to offer their professional services. And that's who's staffing this warm line. It's your friends and neighbors across the state who have experience in mental health counseling, who have decided that they would like to assist those who are on the front lines. And those folks include licensed psychiatrists, psychologists, therapists, social workers, nurse practitioners, and other skilled professionals who can help frontline workers contend with the anxiety, stress, or grief that we know can come from dealing with COVID-19. This effort is a joint effort by and among the Maine Department of Health and Human Services, the Maine Department of Public Safety's Division of Emergency Medical Services, the Maine Association of Psychiatric Physicians, our colleagues at the Opportunity Alliance, the Maine Psychological Association, and Maine's chapter of the National Association of Social Workers. I'd like to take a moment to thank each and every one of those groups for coming together in this way to help stand up this frontline warm line. If you're watching this and you are one of those frontline workers who's grappling with stress, anxiety, or grief arising from the work that you are doing every day, please know that help is available. And please call the Frontline Warm Line. The numbers are 207-221-8196 or 866-367-4440. Those numbers again are 207-221-8196 or 866-367-4440. I'd like again to thank each and every one of those individuals on the front line right now. The heroism that you display in going to work every day and taking care of Maine people who need that help is nothing short of astonishing. and we want to be able to support you physically, emotionally, and in every other way possible as you continue to do that work. If you are struggling right now, please know that help is available, and please call the Frontline Warm Line.